are discussing a few metals. We have discussed argentum metallicum, stannum met, cuprum met, and platina, aurum met. And there are some similarities in all the metals. One thing is that the symptoms are very deep. They affect a lot of systems which are deep within the body. And second thing is that there is a characteristic for each metal, and that characteristic is, that it is either in the respiratory system or in the nervous system. So good to see Dr. Shailendra Sanavar Ali to join this Allen's keynote study streak. Always they are there. Someone on YouTube also, few people. So good to see everyone. And let us study the remedy today, which is plumbum, a very good remedy for the nervous system. One of the first things that Allen's keynotes it is mentioned is that slowness of perception, intellectual torpor, gradually increasing apathy. Now, this condition will develop over a period of time. It can be months, it can be years, but you have to understand the onset, duration, progress. Once you understand the progress of the disease, you will see that the patient has been progressively, progressively means every few weeks he has become weak. That's where we should think of these deeper acting medicines, especially metals and acids. Acids will be the ones we will be taking up the next time after we finish the metals. If you see that this slowness and torpor, or is gradually progressing and the patient is down with fever for a long time, like say few weeks, the remedy is phosphoric acid. But if it is a general for any other disease, it is plumbum. Weakness or loss of memory, unable to find proper words, anacardium, lac, and plumbum compete with each other. Each has its own peculiarity. You will have to confirm from the other characteristic symptoms of the remedy. Excessive and rapid emaciation, general or partial paralysis, extreme with anemia and great weakness. So you will see that anemia is a condition that will not develop overnight, it will develop over a period of time. Once you understand this, you have good knowledge of medicine, you have good knowledge of materia medica, the remedy, when to prescribe. This is one of the biggest challenge for a homeopath. When to prescribe a remedy, and if you understand the characteristic symptoms mentioned by our authors, you will be able to prescribe this very easily. So Dr. Sanavar Ali, you told very correctly cerebral ataxia. But how many times do we see cerebral ataxia in our clinic? Not every day. It will be once in 6 months or once in 1 year, unless you are at a position where you see just neurological cases. So anemia is something that you will have very frequently observed in clinic. Gastric disturbances, especially colic, you will see plumbum is a good remedy. We will go further and see that there is gastric symptoms also. Next symptom we'll see in plumbum in Allen's keynotes is lassitude and faints on going into a room full of company. You saw this in similar symptom in platina, but there he or she feels that she should be of the prime focus when she enters the room. Plumbum will be a person who goes weak in his knees, or collapses, or he may feel awkward when he walks into a room full of people, assumes strange attitudes or positions in bed. One of the interesting things about homeopathy is that all these bizarre symptoms will be our confirmatory tools for prescribing these medicines. So whenever we'll have lot of common symptoms of a disease, these small symptoms, especially the physical generals, likes, dislikes, sleep, stool, urine, perspiration, thermals, are going to be your landmarks for prescribing the medicine. So going further, we have for plumbum complexion, ash colored, pale, yellow, corpse like, cheeks are sunken, expressive of great anxiety and suffering. Skin of the face is greasy, shiny. We see this in natramute, we see this in sanicula. and now we see this in plumbum also. For plumbum, it will be some condition which is developed over a period of few weeks, or it can be months also, or years also, not immediate. Very rare chances that you will have some immediate or urgent manifestation of issues. For the mouth, we have blue lines along the margins of the gums. Gums are swollen, pale, and show a lead colored line. So, for plumbum, there is this peculiar characteristic feature along the gums. You see this also in calcarea silicata. Calcarea silicata will be someone who is in the early teenage, adolescent age. Plumbum will be someone who is in the, early old age. It can be 40s, it can be 50s, or somewhere between 35 and 50. For this symptom, there can be rare chances that it will be seen in early ages. If you find it, well and good. But you should remember these peculiarities. They are not just for academic purpose, but also for clinical relevance, because these are going to be your confirmatory symptoms whenever you are stuck up, and how you will decide to prescribe the remedy. It is based on these symptoms. Delirium alternating with colic. Now there are many medicines which have colic alternating with cramps. We saw this in the first remedy, which is abrotanum. There is a remedy which has colic alternating with chest complaints. Ranunculus bulbosus is a remedy. And here you have delirium, mind symptom alternating with colic. Very interesting. Once you know these beautiful differences between different remedies and their presentation in colic, you will be much faster prescriber than getting stuck up with patient symptom and thinking what to do or how to proceed. And what you see in dioscoria about excessive pain in abdomen, radiates to all the parts from a single part. Same is there in plumbum. Excessive pain in abdomen and radiating to all the parts of the body. Dioscoria has a similar manifestation, and plumbum also has similar manifestation. Once you are able to connect every symptom of each remedy to another remedy, you are at a stage where you know how to differentiate one remedy from the other remedy, and you will have better chances to prescribe medicines, better chances to prescribe medicines in new case and follow up. Next you have for plumbum is sensation in the abdomen at night which causes the patient to stretch violently. So you saw bizarre attitude in sleep. You will see this bizarre attitude in all the acute manifestations of plumbum metallicum. Sensation in the abdomen at night which causes the patient to stretch violently for hours, must stretch in every direction. And the other remedy mentioned is amyl nitrosum. Very interesting, some new remedy has come up. Violent colic sensation as if abdominal wall was drawn by a string to the spine. So you will have these patients who will tell you that something is pulling my abdomen from within. I have this pain, but it is kind of pulling me from within, and I am not able to proceed, or I am not able to express this, what type of pain, but something is pulling from within. Many times you will be confused what to prescribe, how to prescribe. Plumbum is one of the remedies that has drawing pains which is from the spine. Another remedy which is having similar drawing pains is causticum. Go and read causticum everywhere from top to bottom, whether it is headache, whether it is chest, whether it is abdomen, legs, it has drawing pains. Drawing pains in fevers, you will see the remedy Nux vomica. Very interesting. I took this in the fever workshop recently, and there were many cases I shared. And how do the complaints develop in fever? What will be the evolution of symptoms in fever cases? How will the patient express? All these things I expressed in fever workshop. If anyone wishes to have the recordings, we will be putting up soon on for watching. You can pay and watch it soon, and you can stay tuned for such announcements about progressing with homeopathy and continuing your journey as a homeopath ahead with good success. Next you have is intussusception with colic, fecal vomiting, strangulated hernia, femoral, inguinal, umbilical. Now Getting surgical case in clinic is a challenge. If you get it, if you are able to diagnose it, prescribe, it's well and good. But the idea is just not prescription, the idea is also repetition. Cases of intestinal obstruction or cases of intestinal pathology where the patient is writhing in pain, that will be plumbum for you. And what is interesting, homeopaths have forgotten to cure hernia cases. Many times we have lost hope. If you can stay with a single remedy for 3-4 months in the highest potencies, 10 m 50 m, you will see that hernias can also be resolved very effectively if they are not complicated with torsion or indirect hernias. It can be direct hernias, umbilical hernias. These can be managed. The remedies you can think in such a case is, one of the remedies you see that is plumbum, which we are studying right now, and nux vomica and thuja. One of the cases which I have given is thuja. He had a 5 centimeter hernia coming out, reduced to 1 centimeter now, almost on the path of cure. Thuja 10 m every day, twice a day, has helped him in the past 3 months. So we hesitate in giving medicine in repetition, we hesitate in giving medicine in surgical cases, but if we have read cases of our stalwarts, Pogar has given nux vomica 50 m and cm in cases of hernia. Have you ever read any case of it? You must not have read. And if you go through those old sources, those books, they had lot of surgical cases and treated them with confidence. Next you have in plumbum is constipation. Stools are hard, lumpy, black, like sheep dung. Chelidonium and opium is the remedy. With urging and terrible pain from spasm of the anus, obstructed evacuation from indurated feces, dryness of the excretions, paralysis or muscular atony, and during pregnancy, impaction of feces when platina fails. In platina, we read that if nux vomica has been given to a case of constipation, and if you fail, you give platina. But what to do if you fail after giving platina? Next remedy to think is plumbum. This is how you develop the chain of thoughts, from one remedy to another remedy, from other remedy to third remedy. Once you know this, you will be a good prescriber in follow-ups rather than getting stuck up in a maze of symptoms or keeping the patient on placebo loop and the case not heading anywhere, and maybe disappointing the patient, and he will go and take allopathy, suppose, if he is not better. So you have for plumbum constipation, which is sheep dung like. We see this in opium, we see this in chelidonium, we see this in magmure also, we see this in sanicula also. All these remedies have been mentioned in Allen's keynotes, and once you know that these remedies have these type of manifestations, immediately as the patient tells you that peculiar characteristic, it should strike that these 5 or 7 remedies have it, and you will be able to prescribe, because it's a physical general which cannot mislead. A mental symptom will mislead you because you will interpret it from the patient and you will not be sure about it, but a physical general cannot be interpreted. It will be mentioned in your record from the patient as it is. So always rely on physical generals, always rely on physical particulars, modalities or concomitants. Next you have is adapted to diseases from spinal origin. Plumbum is the remedy. Phosphorus, picric acid and zincum are one of the group of remedies which will act similarly. Muscular atrophy from sclerosis of spinal system. So many cases of muscular atrophy, dystrophy and cerebral palsies. We have been giving lot of medicines. Plumbum can be one of the sheet anchors. As a specific remedy, it can work in these diseases and give good results. Spasms, clonic tonic from cerebral sclerosis, tumor, epilepsy or epileptiform convulsions. Plumbum is the remedy for all types of convulsions, all types of epileptic cases, and you will see this remedy also working well in Bright's disease. Earlier name was Bright's disease, but in current scenario we see that recurrent infections which are happening to a female or any patient, and it affects the kidneys in the reverse order. that can develop a condition of acute pyelonephritis. Plumbum can be one of the remedies which can be the can stop the infection from spreading. You will see that this remedy also has colic pain in such cases of urinary disturbances. Abdomen is retracted, rapid emaciation, excessive debility, contracted kidney. So all these symptoms are mentioned in a group, but what you will see is you will see a patient entering your clinic who is thin, who has a blood sonography report which says that the kidneys have shrunken in size, and we will have a urinary report which shows that there are lot of pus cells, albumin and ketones and lot of excretions that are happening which shouldn't happen. And you will examine the patient and see that there is abdomen which is almost sunken inside. All these things are collection of symptoms, observations and subjective symptoms and clinical symptoms from your entire conversation with the patient. It is mentioned in single line, but in practical reality they will be scattered in different places along with the patient symptomatology. So you should know how to collect these and bring together. Plumbum is a remedy which will help in such a case. Next you see is in female reproductive system, feels a lack of room for fetus in the uterus, inability of the uterus to expand and threatening abortion. So many places, many patients will tell you that the space is too less, the placenta is not placed correctly, there will be some vague pathology present in the pregnancy state, no space is there, oligohydramnios is there. Plumbum can be one of the remedies that can help. In the skin symptoms for plumbum, we have yellow skin, dark brown liver spots in climacteric years, jaundice, the eyes, skin and urine is yellow. So climacteric stages, pathology is developing, plumbum is one of the remedies. Climacteric stages, female reproductive system is disturbed, graphitis is the remedy. Try to navigate your way to understand different pathological presentations during different ages of patient, and you will be a successful prescriber. Coming last to the modalities, plumbum aggravation is at night. Metals usually have aggravation in night. Especially you see that plumbum has aggravation of pain in the limbs at night. Amelioration from rubbing or hard pressure. And in relations you can compare, or you see that this remedy is similar to alumina, platina, opium in abdominal cases, colics, podophyllum in retraction of navel, we saw this in urinary system complaints, nux vomica in strangulated hernia, plumbum is very similar, and podophyllum is the vegetable analog. So for each metal, and we discussed this yesterday also, those who are new to watch, Dr. Rashi, Dr. D. Palika, Asha homeopathy learner, I don't know who is online, we can't see that, but Anubhav Saxena, etc., and some few people on YouTube also. If you have not seen my metals videos in the last few days, do go back and see. Every metal has its vegetable analog in the plant remedy. Cuprum has its vegetable analog in Ipecac. 3 days back, a patient I gave Ipecac, she was not improving in the case of cough, very bad cough. I'll be putting up all these cough cases in a cough workshop very soon. And this patient of Ipecac didn't get well. The next remedy I thought was immediately Cupromet. Vegetable analog Ipecac, mineral counterpart Cupromet. Similarly, you have for plumbum, vegetable analog podophyllum and mineral counterpart is plumbum. So you should be able to bring this together to be a successful prescriber, compare remedies, make a relationship of remedies, and that's what we will take you further to prescribe and be a successful prescriber. And for what it should be prescribed, whether it is GI complaint, whether it is nervous system related, female system related, what is it? You should know about all these things, and it will be a very helpful tool for you to prescribe as a practitioner in the follow-ups. Bad effects of plumbum, this is I think a poisoning or overdosage, are antidoted by alumina, petroleum, platina, sulfuric acid and zincum. So in all, we finish a very nice metal remedy today and hope to see you all very soon in the next session. Those who have joined late can again go back to the recording. All the metals, in fact, because there is a commonality we see in all the metals, preferably I would say all the Allen's keynote sessions, because there are some clinical cases that also I have shared some useful clinical tips and some information from my knowledge of different study of different materia medicas and different authors. So that's it from today's session, and I hope this is a helpful video on plumbum from Allen's keynotes. You can let me know in the comments so I know that this content is being watched and you have learned something.